Okay, ma'am.
Okay. So if you have read and understood, considering it critical care scenario, please tell me, how are you going to manage this patient now?
According to the scenario,
Yes,
I'll manage the patient according to the ABCD protocol approach.
yes,
I'll check the airway, breathing, and circulation.
yes,
Here, I'll check the pulse, blood pressure, and, urine output, and and after see the investigation result, I'll consider the patient as a case of hypothyroid patient. So I'll give the thyroid hormone uh, replacement for this patient.
okay. And
I will involve the endocrinologist for the management purpose.
okay,
And
you have to consider the complaints of the patient. Okay, and then one thing that you've already started is thyroid hormone replacement. What
yes, ma'am.
else are you going to? How else are you going
Thyroxine.
to manage the patient?
I'll advise the patient the thyroxine daily.
Yes, more, please. What else?
Thyroxine,
Yes, what else are you going to do?
and also the patient hemoglobin level is
Low?
low. I'll
Yes.
consider the vitamin B12 the patient.
Why?
It's a megaloblastic anemia. Patient suffering from the megaloblastic anemia. Main corpuscular volume is high.
Okay. So what does this signifies?
It signifies the patient suffering from the megaloblastic anemia, that is the pernicious anemia, due to the reduction of the B12, because the anti-parietal cell antibody due to the lack of less intrinsic factor here.
Okay. How is that related with the patient's condition, like complaint, neck swelling or neck lump, and low T3, T4, high TSH? How is that?
Hypothyroidism. Ma'am.
How does that lead to or contributes with the formation of or with the presence of iron, with the formation of anemia
Patient
that you are
less
telling
intake.
me?
Patient may less intake of the nutritious diet, and the anti-parietal cell antibody developed due to the lack of intrinsic factor.
So antibodies develop against what?
Yes, antibody develops about TSS receptor.
Okay, and please tell me more.
The anti-parietal cell antibody develops in the stomach. That's why the lack of the intrinsic factor here also.
Okay, and how is that going to contribute to the symptoms of the patient? That's all I want you to tell me the
The
connection.
malaise patient may lethargy malaise.
Okay, and
The yes, I can say, ma'am, weight gain, patient develop weight gain, constipation, cold intolerance, muscle weakness, hair loss, dry skin, menstrual irregularity.
how much should be the normal levels of T3 and T4? And how are they correlated with the levels of thyroid stimulating hormone,
When
TSH?
the T3, T4 is low, then TSS will be high. But in case of hypothalamic disease, had the T4, T3, and TSS also total 3 will be less due to the hypothalamic or pituitary disease.
Okay, how is
But
are
patient
they
have
affected when there is a cause originated from pituitary gland? What type of hypothyroidism would that be, and how would
that
the results?
that would be the secondary hypothyroidism.
Okay, so now you're telling me there are two types of hypothyroidism, primary and
Yes, primary
secondary.
and secondary.
So what
Yes,
is primary?
primary hypothyroidism when the problem is in the thyroid gland. There's a several cause here also.
Okay, please tell me quickly.
Okay, the main cause is the idiopathic, then iatrogenic due to the radiation surgery or some drugs, then the dyshomogenesis, then autoimmune, that is the Hashimoto thyroiditis, infiltratives, that is the sarcoidosis, amyloidosis, and the infiltratives, that is the deconvert thyroiditis.
Okay, what are the other causes that can lead to macrocytic anemia? Could there be any other cause? Or should we just jump onto it because this is hypothyroidism, so there'll be macrocytic anemia? But what is their connection? How could that be related?
Yes, due to the double lack of the B12, the DNA cannot be synthesized. Due to the lack of DNA, the cell becomes larger without division.
Okay, in this stem patient, it has been observed that patient was not compliant to her
Yes,
medications.
ma'am.
How
Yes,
would
ma'am.
you, what measures would you take to make sure that patient becomes compliant with her medications?
Okay, ma'am. I'll consult with the patient and I will try to understand why the reason he's not compliant due to the psychological or the social problem, and I will involve her GP and the family member. Regarding the drugs, I will consider the single dose and the morning dose of the patient, regular follow-up of the patient, and uh, and I'll try to understand the patients. If you not compliance, the uh, disease will be come back to you again.
Okay. Please tell me, here you've noticed patient had the complaint of lump in the neck. Please tell me, what are the differential diagnoses of a neck lump other
Okay,
than
ma'am.
what you're thinking?
Okay, ma'am. It's maybe
Hypothyroidism.
yes,
Hmm?
ma'am. It's maybe the benign thyroid swelling, maybe the malignant thyroid swelling, maybe the lymph node, maybe the thyroglossal cyst, maybe the secondary metastatic lymph node.
Okay. So, how do you think? Okay, just suppose if you do not get to manage the patient's symptoms on time, and what are the complications that you expect to see in the patient?
Complication of this patient if I cannot manage this.
Yes, please. Because
The
this
patient
patient has
condition,
already
yes,
come
ma'am.
in accident and emergency. So, what can go worse?
The patient may be more drowsy,
And
uh, bradycardia may develop, and
okay,
the muscle wasting of the patient,
yes,
proximal myopathy may develop,
okay.
constipation may develop the patient.
Okay, please define what you understand by the term myxoidemic coma. Myxoedema,
Sorry, ma'am.
coma. Okay. That is what condition when patient goes into coma because of myxoedemia. Okay.